What happens to the prostate of men who drink little water every day? I'm Dr. Camila Vega, urologist. Let me be blunt. Chronically drinking too little water is one of the most underappreciated, reversible forces working against a man's urinary health. It's not glamorous, it's not dramatic, but over months and years, it quietly creates inflammation, irritation, and symptoms that steal sleep, confidence, and quality of life. I see it every day in clinic. If you've noticed a weak stream, urgency, or wake up multiple times at night to pee, stick with me. And if this is hitting home, comment "I relate" so I can see it. I read those. Why hydration matters more than most men realize. When you drink too little, your urine becomes darker, more concentrated, and more acidic. Concentrated urine is not just a nuisance, it's an irritant. Think of it as a persistent, low-grade chemical stress on the lining of the bladder and the small gland that sits right below it, the prostate. That constant irritation can trigger inflammation and a cascade of changes: more urgency, more frequency, the feeling of not emptying fully, hesitancy, weak stream, and increased nighttime voids. Over time, that ongoing irritation interacts with hormones, pelvic floor tension, and metabolic factors to make symptoms worse. This is not the only cause of prostate problems, and it does not explain prostate cancer. But as a modifiable risk factor, poor hydration is incredibly important. In my practice, I've seen men like Don Roberto and Don Pedro who change the simplest thing, how they drink, and get measurable relief within weeks. These are clinical anecdotes, not guarantees. Results vary, and you should always check with your doctor. Still, consider this. Drinking more regularly, aiming for pale yellow urine, and avoiding big fluid binges before bed can stop one common driver of symptoms. 10 lifestyle errors that amplify prostate trouble. Below, I'll walk through 10 common correctable habits that, together with chronic low water intake, push a man's urinary system towards trouble. For each one, I'll explain the physiological idea in plain terms, give a short patient vignette, and offer a clear, practical fix you can try right away. Dehydration is the thread that will run through every item because it often makes these other factors worse. Error 10, voluntary dehydration, drinking too little on purpose. What happens? You purposely drink less to avoid bathroom trips, or you simply forget to sip during the day. The result is concentrated urine that irritates bladder and prostate tissues, promoting inflammation, spasms, and the sensation of urgency. Drinking large amounts only at night to catch up also increases nighttime urination and can destabilize sleep. Clinical vignette. Don Roberto told me he avoided fluids all day to get through work, then drank a big bottle at dinner.
Within 2 weeks of switching to small sips throughout the day and aiming for pale urine, his nocturia decreased and his stream felt stronger. Fix. Make sipping a habit. Aim to keep urine pale straw to light yellow as a rule of thumb. Drink small amounts regularly instead of large volumes at once. Avoid a big fluid load within 2 hours of bedtime. If you use diuretics or have medical restrictions, check with your physician first. Error 9, prolonged sitting. What happens? Sitting for long periods compresses pelvic circulation and can increase pelvic floor tension. Reduced blood flow and chronic pressure can make the prostate feel full and the pelvic muscles reactive, worsening urinary symptoms. When you're also dehydrated, the bladder lining is more sensitive to these mechanical stresses. Clinical vignette. Don Pedro worked desk to desk for 10 hours and came in with urgency and a weak stream. He began standing every 30 minutes and taking 3 to 5 minute walks. Combined with better hydration, his daytime frequency dropped significantly. Fix. Stand up and move every 25 to 30 minutes. Even short walks or simple pelvic mobility exercises help. If possible, use a sit-stand desk and change positions frequently. Error 8. Excessive caffeine. What happens? Caffeine increases bladder activity and can cause urinary urgency and frequency. In men whose urine is already concentrated, caffeine's stimulatory effect on the bladder lining can feel like a magnifier, producing more spasms and urgency. Clinical vignette. Don Jacobo loved his 4 cups of coffee in the morning. Reducing to 1 cup and replacing the later cups with herbal tea improved his urgency and nighttime wakes. Fix. Limit caffeinated beverages to 1 or 2 cups daily and avoid caffeine after mid-afternoon. Try herbal teas, decaffeinated coffee, or simply flavored water as alternatives. Error 7. Ultra-processed foods. What happens? Diets high in ultra-processed foods contribute to systemic inflammation, hormonal disturbances, and poor gut health. These factors can indirectly affect prostate health and worsen symptoms, particularly when hydration and circulation are poor. Clinical vignette. Don Enrique relied heavily on packaged meals and noticed a steady decline in urinary control and energy. Within 6 weeks of adding whole foods, vegetables, tomatoes, legumes, and fatty fish, and improving hydration, he reported fewer urgent episodes. Fix. Swap processed items for whole foods. Focus on vegetables, broccoli, leafy greens, tomatoes for lycopene, seeds such as pumpkin seeds, and fatty fish like salmon. Small, consistent changes beat dramatic swings. Error 6. Habitual urine retention, holding it in. What happens? Regularly delaying urination stretches and weakens the bladder muscle over time, leading to incomplete emptying and a higher risk of urinary tract infections. This repeated strain increases pressure on the prostate and can perpetuate a cycle of symptoms.
Clinical vignette. Don Bernardo dismissed urges while at work and developed increasing nocturia and a feeling of incomplete emptying. After adopting a "when you feel it, try to go within 15 minutes" rule and staying better hydrated, his bladder function began to normalize. Fix. Don't delay when you get the urge. Try not to hold urine for long periods. Aim to void within about 15 minutes of needing to go. Keep a bathroom log for a few days so you and your doctor can see patterns. Error 5. Smoking. What happens? Tobacco introduces toxins that concentrate in prostatic tissue and are associated with increased inflammation and cancer risk. Smoking also worsens circulation and healing, so even if hydration improves, the ongoing exposure can blunt benefits. Clinical vignette. Don Miguel smoked for many years and had persistent symptoms despite other lifestyle changes. He noticed measurable improvement in energy and urinary comfort after quitting for several months. Fix. If you smoke, quitting is one of the most impactful changes you can make for your prostate and overall health. Talk to your healthcare team about a quit plan. Counseling, nicotine replacement, or prescriptions can help. Error 4. Skipping screenings. What happens? Avoiding routine exams delays detection of issues that may require medical evaluation. Early assessment, history, physical exam including digital rectal exam, and PSA testing when appropriate, identifies conditions that lifestyle changes alone cannot fully address. Clinical vignette. Don Andres delayed his annual checkup for years and presented later with more advanced symptoms. Early screening could have clarified the problem sooner and allowed targeted therapy alongside lifestyle changes. Fix. If you're over 50 or over 45 with risk factors, or if you already have bothersome symptoms, schedule a discussion with your primary care physician or urologist. Screening decisions are individualized. Don't skip the conversation. Error 3. Excess red and processed meat. What happens? Diets very high in red and processed meats are linked with systemic inflammation and exposure to compounds that may affect prostate health. Coupled with low water intake, these dietary patterns can worsen symptoms and metabolic stress. Clinical vignette. Don Jorge ate red meat almost daily. When he reduced red meat, increased fish and legumes, and improved hydration, his energy improved and his urinary symptoms eased. Fix. Limit red and processed meats. Prioritize fish, poultry, legumes, nuts, and whole grains. Simple swaps, 1 or 2 meat-free days per week, are a practical start. Error 2. Abdominal obesity, visceral fat. What happens? Visceral fat is metabolically active and drives inflammation and hormonal imbalances that can act on the prostate. Excess waist circumference is associated with worse urinary symptoms and poorer response to lifestyle changes if not addressed.
Clinical vignette. Don Juan Pablo carried much of his weight around his waist. A focused program of walking, attention to portion sizes, and improved hydration led to measurable symptom relief, alongside modest weight loss. Fix. Losing even a few inches from your waist can help. Start with brisk walking 30 minutes most days. Reduce ultra-processed foods and prioritize consistent hydration. Consider structured weight loss programs if needed. Consult your doctor to choose safe strategies. Error 1. Chronic stress and pelvic tension, the silent amplifier. What happens? Chronic stress elevates cortisol, promotes inflammation, and often increases pelvic floor tension. Men under stress also tend to sip less water, sit more, and reach for caffeine and processed foods, making the dehydration prostate loop worse. Clinical vignette. One patient, after a stressful year, developed worsening nightly waking and urgency. Incorporating daily breathwork, short walks, and magnesium supplementation under medical supervision reduced his anxiety and improved urinary symptoms. Fix. Add a daily stress ritual. 5 to 10 minutes of diaphragmatic breathing, a short walk, or a quiet cup of non-caffeinated tea. Pelvic relaxation techniques and simple stretching help. If anxiety is severe, seek professional support. Small changes, big effects. Common sense fixes that stack. Across these 10 errors, the message is simple. Hydration is an underused, powerful lever. Addressing how you drink amplifies the benefit of standing more, cleaning up the diet, quitting smoking, and managing stress. Here are concrete rules of thumb you can start today. Urine color. Aim for pale straw to light yellow during the day. Dark yellow indicates concentration. Clear may suggest overdrinking or that you're taking diuretics. Discuss with your doctor. Sip steadily. Carry a water bottle and take small, regular sips rather than waiting and binging. Nighttime. Reduce large fluid intake and caffeine in the evening. Try to finish significant liquids at least 2 hours before bed. Movement. Stand and move every 25 to 30 minutes during sedentary work. Bathroom timing. Try to avoid within about 15 minutes of feeling the urge. Avoid habitual holding. Diet swaps. Favor whole foods, vegetables, tomatoes, broccoli, seeds, pumpkin seeds are anecdotally supportive, fatty fish, and legumes. Screenings. If you're over 50, symptomatic, or have risk factors, schedule a prostate discussion with your provider. A 4-week rescue protocol you can follow. Below is a practical, week-by-week plan designed to interrupt the dehydration irritation cycle and begin measurable improvement. This is a lifestyle protocol, not a substitute for medical care. If you have heart or kidney disease or take medications that affect fluid balance, consult your clinician before making major changes.
Week 1. Immediate stabilization, habit, and hydration. Goals. Normalize urine concentration, reduce nighttime load, break the big gulp pattern. Actions. Start carrying a water bottle and sip throughout the day. Aim to keep urine pale yellow. Avoid large fluid intake within 2 hours of bedtime. Cut late afternoon caffeine. Limit total caffeine to 1 to 2 cups early in the day. Stand up every 25 to 30 minutes while working. Begin a simple voiding log. Record times and approximate volumes for 3 days to establish baseline. What to expect? Many men notice fewer urgent episodes and a modest improvement in stream within 7 to 14 days. These are individual results. According to cases I've managed, some see marked changes within a month, but this is anecdotal. Week 2. Intensification, diet and pelvic balance. Goals. Reduce inflammatory dietary inputs and calm pelvic reactivity. Actions. Reduce ultra-processed foods and add vegetables, tomatoes, and healthy fats. Include pelvic relaxation exercises, diaphragmatic breathing for 5 minutes in the morning and evening, gentle pelvic floor stretches. If you smoke, begin a quit plan. Continue hydration habits and movement breaks. What to expect? Reduced urgency, improved bladder comfort, and better sleep begins to consolidate for many patients. Week 3. Targeted changes, metabolic and supplemental support. Goals. Address metabolic contributors and support restful physiology. Actions. Limit red and processed meats this week. Add fish or plant-based protein 2 to 3 times. Start a daily 30-minute walk or equivalent moderate activity most days. If appropriate and after medical discussion, consider supplements mentioned in clinic. For example, magnesium, zinc, and vitamin D have roles in overall health and muscle relaxation. Discuss exact dosing with your physician. In the cases I report, magnesium 400 mg was used under supervision. This is an example from clinical practice, not a blanket prescription. Measure waist circumference and note small changes. What to expect? Increased energy, better sleep quality, and often incremental improvements in urinary stability. Week 4. Consolidation and monitoring. Goals. Make the new pattern sustainable and evaluate progress. Actions. Continue hydration, movement, dietary swaps, and stress strategies. Revisit your voiding log and compare frequency and nocturia to week 1. If symptoms persist or are worsening, schedule a medical evaluation for a personalized plan, PSA and exam discussion as indicated. What to expect? Many men report a meaningful reduction in symptoms. In the clinical cases I've seen and presented, some men reported 50 to 70% subjective improvement within 30 days. That is an observation from practice, not a guaranteed outcome. Short note on supplements and medications. You may hear about supplements such as magnesium, zinc, or vitamin D in relation to urinary or pelvic health. These can be part of a broader plan, but they are not a substitute for hydration, movement, and medical evaluation. If you're considering supplements, discuss them with your doctor first to ensure safety and appropriate dosing for your health profile. If lifestyle measures are insufficient, your doctor may discuss medications or procedures as part of shared decision-making, not as an automatic next step. When to see your doctor now. Make an appointment if you have persistent or worsening symptoms, difficulty urinating, blood in the urine, recurrent infections, pain, or a sudden change in urinary function. If you're over 50 or younger with risk factors or symptoms, a prostate discussion, including the pros and cons of PSA testing and a focused exam, is reasonable. Early medical input helps rule out causes that require specific treatment and guide safe, evidence-based steps. What I tell men in clinic. I always tell my patients 2 things. First, age is not an unchangeable sentence. Many symptoms we see are influenced by modifiable habits, hydration being one of the most powerful. Second, small, consistent changes compound. Carry a bottle, stand up often, swap one processed meal for a real food plate each day, and add a 5-minute breathing practice. These steps are simple, but together they translate into better sleep, fewer interruptions, and more confidence. Realistic hope, not promises. I want to be clear.
lifestyle change is not a guaranteed cure for every prostate problem. For some men, medications or procedures will be necessary and appropriate. What I can promise is this: fixing a habit as basic as how and when you drink water is a low-cost, low-risk step that often produces measurable benefits and makes other therapies work better. In many clinical cases I've managed, improvements are visible within weeks when hydration is corrected and paired with other lifestyle adjustments. Again, these are observed results from practice, not universal guarantees. Closing encouragement and action. If you're watching this and thinking, I skip water because I don't want to wake up at night, know this paradox. That behavior often creates the very problem it's meant to avoid. Start today with one small change. Carry a bottle, sip regularly, and aim for pale yellow urine. Stand up every half hour. Cut late caffeine. If you're over 50 or experiencing bothersome symptoms, schedule a prostate evaluation this week. You don't have to accept disrupted sleep or a diminished quality of life as inevitable. If this video spoke to you, comment "I relate" so I can see who's listening. I do read and try to respond. And if you found this useful, subscribe and share it with any man in your life who might benefit. A small change could literally change someone's nights and days. I'm Dr. Camila Vega. Take care of your water, and you'll do a lot of good for your prostate.
If you have questions about any of the steps I mentioned, leave them below, and please check in with your healthcare provider for personalized guidance.